Welcome to this ValueMed presentation and demonstration video for the OnCall Plus 2 blood glucose meter. Part 1 of this video, we're going to show you the box contents of both the starter meter pack as ordered here. This is the standard packaging for that, and also the packs of 50 OnCall Plus 2 glucose test strips. You'll note that both are CE marked 0123. This covers self-testing glucose in whole blood for self-testing and professional end use. And the other ISO note to bring to your attention is that this meter system does have the ISO 15197, which is the higher quality certification on the ISO scale. So if you're looking for a good quality all-round general purpose blood glucose meter that gives accurate and reliable readings, then the OnCall Plus 2 and its meter system and test strips will be of interest to you. Well, let's run you through the box contents, what you get when you start with the OnCall Plus 2 blood glucose meter starter system. You get a full user's manual in UK English, which guides you through all the elements of setting up the meter, operation, and the error codes that can sometimes occur. So that's a comprehensive user's guide. You also get a quick reference guide. This is for the men that buy this unit and really can't be bothered reading the full instructions. That just tells you how to quickly set it up and operate it. There is an OnCall Plus 2 glucose control solution pack insert, and packed in with the meter, you'll see here this little zip case for storing the meter and its gubbins. You get the OnCall Plus 2 meter with a little bit of safety film over the top, and you get the CR2032, I think it is, cell battery, and a vial of OnCall Plus 2 control solution level 1 should you wish to need to do a control test. But normally that would not be necessary out of the box. These are pre-calibrated, and by entering the code chip that is supplied with the separately purchased pack of the OnCall Plus 2 glucose test strips, the coding chip contains all the calibration information for that specific batch of test strips. But in the actual box pack, you do not get any starter test strips. This is why we usually sell this as a bundle with a carton of 50 OnCall Plus test strips. The other thing that is absent from this pack, as you will be aware if you are not previously doing blood glucose checking, is there is no Lancet or lancing device to facilitate finger prick lancing. So again, the bundle we normally sell contains Lancets, a lancing device, the additional pack of test strips, and the OnCall Plus 2 starter meter pack. When you first get the meter, you need to insert the battery. The battery compartment is on the side here, and the battery goes with the positive side upwards and then just slides back into the meter. Nothing will happen initially, but if you press the S button, the meter will power up, full display, and ask whether you want 24 hours or 12 hours. You can toggle between using the M button. I'm going to leave this one in 24-hour mode. Press the S. You will get the year up in the top right-hand corner. Again, toggle to the correct year, 2024. You will then get the month. We're going for August, and then the day, through to the 19th. There we go. Then S again for the hour, and because you're in 24-hour mode, that should go through to 13:14 for 2 o'clock, and I'm going to set this for 2:15. Now the meter comes preset with an audible function, which means it beeps when it first goes on and when it does a function. It will automatically be set on, but again, you can use the M button to toggle between and switch this off if you don't want the audible tones for it. Once you're happy with that, press the S button, the screen will go blank. This meter is now set with time and date and is ready to perform the first test. Now, before you perform the first test, it's necessary to take one of the code chips from the pack of test strips that you will have been supplied. You have 2 code chips, one for each file of test strips. They will normally be the identical same code, and the code is on the side of the file here, 185, 185. You need to insert the code chip into the meter on the port on the opposite side from the battery compartment. If you press the S button again, it will run you through the setup with the code chip. If you just remove that and push it back in, again, that is ready now to perform the first test. If you now remove a test strip from the vial, sealing the vial immediately after doing so, and insert the test strip into the top port on the meter should recognise the test strip and check the code and should display the correct code for you there, 185, which corresponds with 185 on the code chip and 185 on the side of the vial. The meter is now ready to take blood sample into the top port on the test strip. Now the port for blood entry is on the very end of the test strip in this very narrow area. You don't apply the blood onto the top of the test strip, you put it onto the end of the test strip, and it should, by capillary action, flow into the test strip and commence testing. So that meter is now ready to take a sample of blood and run a first test. You have 5 minutes to do the blood sample and to apply it to the test strip. If it times out, you can simply, if it's not been triggered, remove the test strip and reinsert it. It will start a new countdown. Should recognise the 185. There we go, ready. Now let's prepare this lancing device to undertake a finger lance. If I remove the cover, you'll see the cylinder for the lancet to go into. Just push that in firmly into the device and then twist the cover off the sterile tip lancet, revealing the lance. You then reconnect the cap, and the setting device on the side of the lancing device will go from 1 through to 5, 5 being the deepest lance and 1 being the most superficial. When you're first doing lances, we recommend you start on the deepest lance setting until you get familiar with the process and get good quality blood samples. Blood glucose only requires a very small droplet of blood, so you can get away with doing quite superficial lancets once you've got the technique mastered. The next key element is to go and wash your hands before you do the finger lance. In clinic settings, they will use a sterile alcohol wipe to clean the finger area and remove any bacteria. But by washing your hands, you can do just as good a job giving yourself a nice clean area for lancing, but also it will help with the capillary flushing and general amount of blood in the fingertips. And then when you've washed your hands sufficiently, use a downward massaging motion, again pushing blood towards the distal end of the fingers. And then we recommend that you lance on the side of a finger rather than on the flat pulp of the finger. This is because the skin on the side of the finger tends to be less thick, there's less nerve endings, and it's more vascular, so you get a better sample. Now I've washed my hands, I've massaged my hands really nicely. You'll see my meter's timed out, so I'm just going to remove the strip and insert it again. Wait for it to ask for the blood droplet to be added, and then I'm going to apply this lancing device to the side of my finger and trigger it. And you'll see a nice droplet of blood forming. With glucose, there's no need to wipe away the first droplet. You can if you want and use the second, but just apply the drop to the end and you'll see only a small amount of blood is needed to trigger this. And there's my blood glucose almost instantly detected and measured at 5.2. We recommend it's useful to have a little bit of tissue paper or a plaster to hand, just so you can keep some pressure on the area you finger lanced and not drip any blood anywhere. So it's quick, easy, very reliable and incredibly accurate. The blood glucose readings from this meter really are very close to hospital levels, and they can be relied on once you've got the lancing technique right and you know how to use the meter. There are instructions on how to use the memory function, because once you've programmed the time, date and hour, this meter will record all the readings that you take on it, and I think it's got a a 300 result memory that it will contain, and they can be scrolled through using the M&S buttons. Instructions how to do that are in here. The other thing we would draw your attention to is in the rear of the manual. If you are having problems getting the function of this, there is a very good section on page 34 and 35 which runs you through what the error messages are: E0, E1, E2, 3, 4, 5. There's an auto-diagnostic function built into this meter, so if you're having problems with it, before phoning us, do have a look at page 34 of the meter and see what the error message is detecting, and you may be able to correct that yourself. If you are still having problems, then customer services are available at the ValueMed offices in the UK during office hours Monday to Friday between 9:30 and 4:30. The telephone number and contact details for that are in the lower section links from this video in YouTube. Thanks very much for watching.